The thing is that you have to be able to get a better relationship with yourself. Having a spiritual relationship is so critical in the addicts treatment and the people supporting them. We're watching the Dr. Nandi show, and what we're learning today is that there's a lot more that can be done to help people recover from their addiction. And I'm joined now by a doctor who says it doesn't matter what the addiction is, drugs, drink, shopping, or sex. The root cause is the same. From Michigan's Dawn Farm Treatment Center, please welcome Dr. Carl Christensen. Dr. Carl, thank you so much for joining us. Now, I think that we know that there's a genetic link to addiction, but what else do you think has been linked to be at least somewhat of a cause for addiction?
So as you know, the genetics are important, especially for males. Trauma is important also, and trauma can be either emotional, physical, sexual. It doesn't have to be something as horrific as rape trauma. It can be splitting of a family. It can be abandonment that lasts until adulthood. It can be a drug that is so reinforcing, which is the essence of addiction. A drug is so reinforcing that it can cause addiction all by itself. And the ones we typically talk about are crack cocaine, tobacco, and also food. And then once somebody is in recovery, you can take somebody who is stable in recovery and you can cause a relapse by either exposing them to that drug or putting them under stress. And we talk about in early recovery, don't let yourself become hungry, angry, lonely, or tired. That's HALT. Or being exposed to a cue. So you can walk past a bar or walk past your old drug dealer, and just the cue of doing that will cause an overwhelming urge to use.
And what about that statement I was talking about, is that addiction is a response to some sort of pain? What do you think about that?
It's true. It can be either an underlying genetic condition or it can be something that has happened to you during your life. And actually, chronic pain itself can also, in some people, trigger an addiction.
And by pain, I do mean more, not even just physical pain, but emotional pain.
Yes.
And it's a reaction that I think people, I think judge, addiction in a very different way. When you have somebody with an addict, how does the brain behave under the circumstances of being under the influence of a drug or a substance or whatever behavior? How does the brain behave under those circumstances?
So think about three different parts of your brain. There's your frontal cortex. That's your impulse control, your judgment, your thoughts. There's your hindbrain, which is the withdrawal center. And withdrawal is not the cause of addiction. Withdrawal is over very quickly. And most people, once they go through withdrawal, never have a problem again. And then in the middle is your primitive forebrain. We call it the lizard brain, which is your pleasure center, your nucleus accumbens that releases dopamine, and then your memory pathways, your hippocampus, and different parts that respond to stress and respond to emotional cues.
How about the stigma, right? So much has been said about people who are addicts, just stick them in jail and forget about them because it's them, those bad people. What do you think about that stigma? How should we approach people with this?
So there's an extra layer of stigma compared to other people with mental illness, because people with addiction will commit crimes and they're responsible for those crimes.
Right.
So that stigma gets held up as, let's punish them for their crimes, and society can do that, but it doesn't treat them. And typically someone with addiction is incarcerated for a short while, and then the whole thing starts over again.
Yeah, and the shame and the guilt has to stop as well. What about other forms? Should we give them financial resources? How should we support these people that are going through it? Well, listen, if you have a diabetic that's going through a crisis or a person with heart disease, we don't typically incarcerate them if they, for example, are desperate to get their medication. How should we help these folks?
So first off, there's many different available treatments. So as a physician, we know that we need to give the patient informed consent and give them the different available treatments. And one of the first treatments available is counseling. The most common counseling is called cognitive behavioral therapy, where you try and identify a false belief that a patient has that leads them to addictive behavior. You can also have medication, and there are 3 medications that are approved for opioid dependence. It's methadone, buprenorphine, which we all call Suboxone or Zubsolv, and then naltrexone, which we all call Vivitrol. And finally, there is a spiritual program, and I think the men and women that we've heard from most recently have a spiritual program, which to me means they have made a connection with something bigger than themselves. And spiritual programs can be 12-step, Narcotics Anonymous, Alcoholics Anonymous. It can be faith-based. It doesn't have to involve religion, but it has to involve recognizing there's something out there bigger than yourself, and you have to take direction.
And that's so critical. I appreciate you telling us that. The thing is that you have to be able to get a better relationship with yourself. And what he said at the end about having a spiritual relationship is so critical in the addicts treatment and the people supporting them. You cannot do this alone. You have to have, everybody here has had some support. Dr. Christensen, thank you so much for being here. Really informative. I appreciate it. Hi everyone, I'm Dr. Partha Nandi. And if you enjoyed that video, you're gonna love the next one. It's full of incredible information to help you start your health hero journey.